Of course, ArchiTech is not only the partner for us today in this event. ArchiTech is the tech partner for the NIN Health Alliance. And we are very fortunate to have Rob Russell with us in the room. So Rob is the founder and managing director of ArchiTech. ArchiTech itself is a leading Australian technology solutions provider specialising in secure mission-critical ICT for healthcare, government and essential services. And I know that Alison, I'm not sure if she's stolen your thunder or set you up well for a chat about digital front door. Rob has more than 25 years industry experience. He's widely respected for his architectural expertise, integrity and delivery discipline. And under Rob's leadership, ArchiTech has grown from a regional healthcare-focused consultancy into a nationally trusted partner for some of Australia's most complex and highly regulated organisations, while at the same time remaining hands-on with the tech in both technical strategy and client engagement, helping to build resilient digital platforms. Rob, look at that. Please make him welcome, everyone.
Thanks very much and good afternoon to everybody. First of all, I'd just like to say a big thank you to the Flinders Uni team, specifically the Digital Health Research Centre and the Innovation Central Innovation Central Adelaide. Very proud to be and humbled to be sponsored, and also what a wonderful audience, a mixture from academia, from industry and from the industry sector. It's phenomenal. So as far as ArchiTech, who are we and what do we do? So we've got 20 years experience working primarily in the healthcare sector and primarily in the public health care sector. So 20 years ago, it was all about building networks and connectivity. And we've worked in the smallest bush nursing hospitals in the middle of nowhere to working with large organisations like Alfred Health and Monash Health in Victoria. And more recently, we've been working in Canberra and over here in Adelaide as well. Through that experience, we've always tried to solve wicked problems. Initially, it was a lot around, there wasn't connectivity, there was issues around security, it was even just trying to get good telephony in some of these locations. So we've been on that journey and we've been through a lot of iterations and innovations where we started going, oh, hang on, now that we've got a good network, what can we do with it? And it was about, okay, let's connect the nurse call system up and present nurse call messages to the clinical staff. You know, we started around that. Then real-time location systems come around and talk about wicked problems. I think mentioning it before, you know, there was a promise of a technology and often there's shortfall. And that's where our experiences come into play, in that we've got 20 years of experience of trying to innovate in healthcare. So it's not just around the flashing lights and network connectivity. That's all just staples. But for me, I think the opportunity for us is that it's never been better. The platforms are there, we can build upon those, and that's where the excitement is. So some of the things we've been involved in have been around asset tracking, duress systems like what Alison was talking about there, and some of the new functionality that can come from AI and cameras and detection, and preventing a duress event before it even occurs. So what the value exchange for us is that we've got 20 years experience of on the ground trying to deploy technology or deploying technology solutions. We've seen a lot of projects do really well, but we've also seen projects where they stumble and what some of the challenges are. And often on the ground, those challenges can be just getting the right people in the room, having the right stakeholder engagement, and often we're the bridge that helps on the ground talk to the clinicians, talk to IT, talk to engineering and facilities, and actually help build that bridge together into a program and a project that we think can have the best chance of actually succeeding in the real world. The value exchange for us of being a part of the NIN is we get to hear from all you amazing people. We get to benefit from the research that you guys provide, and we can also bring to you guys what we see on the ground as real world problems as well. So it's a two-way exchange for us where we get to learn from your awesome research and then try and translate that into real world solutions that we can take to market. We have the benefit of having a lot of key friendly stakeholders. The thing I love about healthcare is everyone wants to help solve these problems. It's about then getting the right people in the room to be able to solve them. And we're able to share that information. So we often hear about a project that might be similar to something that was done in Victoria and they're going to try and do it in New South Wales. We can actually provide input and insight as to what worked and what didn't work And I think that's really valuable. The other train of thought, sorry, the other thing that we're doing, just want to touch on the digital front door. So that word's used a lot and can have different meanings to different people, but I guess it's all around this patient-centric, or as I've learnt from Trish today, consumer of healthcare, is that right? Of how we get them more connected more readily. So the digital front door is around being able to engage with patients or healthcare consumers early on. So we're running some proof of concepts, some proof of values in Victoria. We've got one in a regional hospital, Maryborough, at the moment, and that's around preparing patients to come in for surgery. So being able to engage early in that process, send them information, maybe to prepare, make sure they are prepared. If they're on a wait list for surgery, make sure their health hasn't declined, maybe send them a questionnaire, maybe send them some videos on how to prepare. And then whilst they're in surgery, their loved ones can get notifications of where they are in the perioperative process. And then post-care, if they've had a knee replacement, for example, what should they be doing? How should they be rehabbed? So for us, it's all around the innovation, the integration, the automation, and having that connectivity with the care pathways and having systems to support that. It can be very challenging as we've got electronic medical records and patient administration systems, but the technology is all there. It's around how you bring the right people and the right stakeholders together to be able to centralise those opportunities. So the NIN is a brilliant vehicle for us too, because we're able to leverage Cisco's partnership specifically and tap into funds like Cisco Digital Acceleration Funds, where we can stand up a proof of concept and have it funded to get an outcome. So for example, with the aged care, with the brilliant work that Alison and her team and that do around aged care, we're able to identify specific projects. And it could be about onboarding people into residential aged care and making that carer experience more homogenised, more simple, more easier, and supporting the carer in that process, and whether that carer is someone at home or whether that carer is a hospital actually transitioning an aged person into residential aged care. How can we simplify that whole process and make it easier? So that's what we're about. So again, thank you for being here. It's wonderful, and I appreciate the opportunity to speak to you all. Thanks very much.